David Ollila, and I am the James and Jesse Millis Distinguished Professor of Surgery here at the University of North Carolina in the Division of Surgical Oncology. I'm a fellowship-trained surgical oncologist, trained in all aspects of surgical oncology, and as my career has progressed and as the division has gotten bigger, I've niched into complex skin cancer and breast cancer. I became a surgeon because surgery was some identified problem, use my hands and my brain to fix the problem. When I was training in the early 1990s, I had two mentors that had actually done fellowships. I saw how they brought something different to the table because they actually had dedicated their entire career to a single discipline. And as I was debating it, I was really attracted to the complete care of the cancer patient. And so that's why surgical oncology became my defining career path. Now we're up to 10 surgical oncologists at UNC. And so for us, if we're actually going to have an academic presence, we don't want to be dispersed over multiple different tumors. So as we've gotten bigger, each of us have niched and gotten narrower in our focus of what we do. Then you ask, how in the world do you marry complex skin cancer and breast cancer? And the answer to that is sentinel node. Sentry, it's the guard. It's the first lymph node on the draining pathway away from a tumor. You take that lymph node out, take the sentry out, and if it's got tumor in it, now you have more complex discussions you need to have. If the sentinel node is clean, or if the guard is clean, then we know from lots of different studies, the rest of the nodes are clean. No need to remove them. It's a really elegant way to identify whether or not a patient's tumor is spread. And I trained with two of the godfathers of sentinel node out on the West Coast, Don Morton and Armando Giuliano. And so UNC at that point was looking for someone that could bring the new technology here. For breast cancer and for complex skin cancers, every Wednesday, we're all in a room together. The pathologist, the radiologist, the radiation oncologist, the medical oncologist, nurse practitioners, the surgeons, we're all in a room. The nurse navigators, the geneticists, everyone who would come in contact with the patient is in the room, and we're coming up with the best treatment plan for that individual. And then throughout the week, the different disciplines deliver the message and set the treatment plan in place. So that's what we mean by multidisciplinary. It truly crosses all disciplines from all that I listed. One of the things about me is I tell the patients with as much clarity and honesty as I can where I think they are on the disease spectrum. And I want them to know that with all the advances, especially in melanoma, that go into Dr. Google, they may not be reading the right thing. And so I want them to know that I'm going to present them as cutting edge technology and information as I can possibly provide, and then take really good care of them throughout that whole process.